Dear learners, welcome to Module 4, where we will be discussing the segment of 4.1, that is Outreach Activities in Social Protection. I am your facilitator, Dr. Fareeha Armughan, and we have some learning objectives for this particular segment. In this module, we will learn about the concept and importance of outreach in social protection programs. We'll discuss challenges in designing an effective outreach tool. We will also explore the effective outreach strategies, modalities, and instruments. Lastly, we will learn how to tailor outreach modalities according to specific intended population. We will learn these steps with global examples, and the learners will be given an exercise to ponder upon. This module also includes a quiz at the end, so let's begin. So what are the learning objectives? What do we want to achieve through this segment of the module? Initially, we intend to understand the concept and importance of tailored outreach strategies, then learning to design effective outreach tools, and transitioning to the ability to distinguish between survey outreach and on-demand approach. So starting off, there are challenges in making a successful and effective program. And these challenges are how to make people aware of social protection programs, how will people learn about program objective and rules, as well as delivery processes, such as intake and registration, and how do the administrators ensure that intended populations and vulnerable groups are reached. These are the tasks of the outreach phase of social protection delivery systems. So, outreach is the first phase of social protection delivery chain, and it is critical to determining the effectiveness of delivery systems for any social protection programs. And if you can see the figure that is given here, it shows the social protection delivery chain and the four essential pillars: access, enrollment, provision, and management. And then there are multiple subcategories within these pillars. For example, access has subcategories of outreach, then transitioning to intake and registration, and then assessment of needs and condition, and so on. All the rest of the three pillars, they also have subcategories, and I will really appreciate if you can go through this in detail. So outreach involves interactions to inform people about social protection programs and delivery processes, and to create adaptations to encourage them to engage. And if you can see the slide, deliberate efforts to reach and inform intended populations and vulnerable groups about social protection programs and delivery system in ways that will comprehend, so that they are aware, informed, able, and encouraged to engage. So this is the objective of the outreach. The definition of the outreach that we gave in the earlier slide has several elements. Number one, the very purpose: to inform people about social protection programs and delivery system. Second, it's all about the people. The focus is on the intended population essentially, and ensuring that they are reached. The intended population may include, among others, children, youth, and elderly, or other demographic groups. It may include the poor or other groups defined according to their socioeconomic status. It may include the unemployed or other job seekers. It may include persons with disabilities, persons who are vulnerable, and families facing social risk. Another element is of proactive approach, where the efforts are deliberate and tailored to ensure that the intended population is reached and that they promote understanding, awareness, and ability to engage. So what are the aims of the outreach? The aim of the outreach is to inform people about social protection program and delivery systems so that they are part of the process. It means ensuring that people understand various aspects of social protection programs, such as objectives, program rules, eligibility criteria, scope, and content. Secondly, another aim is facilitating their understanding of delivery systems, including processes, institutional actors, point of contact, and how to contact them. Timing and place of registration is also very important, and rights and responsibilities, channels for filing grievances, complaints, and appeals, they are all part of the aims of the outreach. Thirdly, facilitating understanding, awareness, and access to specific components of delivery systems such as social registries or other related systems such as payment systems, civil registration, and foundational ID system is also of integral importance. So, who else should be considered in the outreach phase? In addition to the intended population, outreach efforts should involve other stakeholders who often have characteristics that may influence directly or indirectly those who are hard to reach. Beyond the intended population, the program needs outreach to others, including the ones mentioned on this slide. At the household level, key members who influence behaviors and increase the level of motivation and participation. For example, in Djibouti, outreach efforts emphasize the involvement of grandmothers to promote child nutrition, health, and women participation. Secondly, at the community level, professionals and relevant service providers who help facilitate referrals as well as staff of other programs who might be in position to inform about the program, such as community leaders, teachers, doctors, and others who can influence changes through interaction with parents and caregivers, as well as one-on-one interaction with hard-to-reach population of children and youth. Further, at the level of intermediaries or those who are able to influence changes in the community, who then do outreach to the intended population, such as social workers and civil society. And lastly, at the local and national levels, these are the key stakeholders, including media, politicians, donors, and local bodies or leaders who are able to influence the atmosphere and attitudes, generating relevant knowledge about the intended population and available programs and services. Now, coming to the outreach strategies. So, what are the optimal outreach strategies? There's no one size fits all approach. Outreach strategies varies according to content, context, objectives, and the characteristics of the intended population. Adapting outreach modalities for the specific intended population and vulnerable groups enhances the likelihood of their effectiveness. So, concerning outreach strategies, diagnostic is the first step in designing an outreach strategy. While these may be carried out in advance, they can also be helpful during implementation to help provide feedback and support, mid-course corrections to improve understanding, verify that intended population groups are being reached, and clarify myths and misperceptions. The approach and ambition of the outreach strategy must be tailored according to the size and characteristics of the population as well as program's objective. Diagnostic tools can include situational analysis, communication needs assessment, and stakeholder assessments. So, what are the outreach challenges? In designing an effective outreach strategy, it is important to make it proactive and tailor it according to the needs and diverse challenges of the population. If you can see, the table here highlights some of the outreach challenges that could be faced by these groups. So first, we consider demographic groups along the life cycle. So these include children dependent on parents and guardians for access. These also include elderly who may have limited literacy, digital access, mobility, or challenges relating to aging. And then the women who may face mobility issues, domestic violence, or stigma. Apart from the earlier mentioned groups, there are also other groups constrained by socioeconomic status. And this group includes people living below the poverty line, having lack of awareness, misconceptions about programs, limited literacy or digital access, and family challenges or stigma or shame for their economic situation. Then comes another category of homeless who may be invisible to the program or system and again facing lack of awareness or stigma or shame Another category is of people living in isolated and remote areas, along with a group that is nomadic and semi nomadic in nature with no permanent address or no identification credentials. Another category constrained by socioeconomic status is of indigenous groups who have challenges associated with living condition, income level, employment rates, and also facing multiple deprivations. Then there are also refugees, immigrants, internally displaced populations, and people living in areas affected by conflict and violence. And they do face physical and social isolation. There are also ethnic, religious, linguistic, and visible minorities who may have poor or no identification credentials, may face language and cultural barriers, discrimination. Then, if we see from the lens of labor and work condition, we have these groups of unemployed, of discouraged, inactive workers under shadow or no employment, then informal sector workers with poor social insurance or health or compensation or saving for the old age, and also the forced or child laborers. In terms of persons with disability, they may have access barriers related to mobility, physical status, cognition, or language or reading challenges, along with facing stigma or discriminatory attitudes. Among the vulnerable individuals facing specific social risk, we have the categories of children at risk, children that are dependent and may face challenges advocating for themselves, then youth at risk, youth that is not educated, employed, and may not be visible to the program, and lastly, the adults at risk who may lack information about protective services and again may face stigma or do have complex needs and not know where to go for help. So, how to address these challenges? How to address these vulnerable groups that we discussed in the earlier slides? So, there are diverse modalities and instruments for outreach. Social protection programs and delivery system use a variety of modalities for outreach, often in combination. These are divided into four broad categories: direct modalities, community based outreach, outreach via intermediaries, and outreach via information campaigns and technology. So, when it comes to direct outreach modalities, these seek to communicate directly with people, either one on one or in groups. Communication and outreach efforts are carried out by program or delivery system administrators and directly reach intended population. These direct interactions can take place in two ways. One, if the intended population already knows enough about the existence of the program or local offices to seek support, then an interaction may occur on demand between them and the administrators, particularly specialized outreach officers or caseworkers. Another outreach modality is community based outreach, and these rely on local actors to reach out to intended population and disseminate information. Such methods can involve trained peers who both come from the intended population and reach out to them on behalf of the program. They can be quite effective with youth who may be more likely to trust their own peers. Community based methods can also involve local leaders, mother group, faith based leaders, community organization, etc. Such methods can be effective with people living in remote areas or representatives of culturally distinct communities, since the peers or the community leaders are one of their own, can speak their language, and understand their situation. A community based outreach model in the Republic of Yemen Social Development Fund focuses on using existing networks in the community for outreach. Another example of community based outreach in Pakistan is Benazir Income Support Program, which was tailored on the basis of communications diagnostics and involves an extensive network of mother groups and mother leaders as outreach agents. Another modality of outreach is outreach via intermediaries. Schools, health clinics, shelter, jails, housing offices, and other such intermediaries can promote information on social protection program. Health workers, school counselors, or case workers from other program may make personalized referrals for individuals or families to the social programs based on risk flags or other factors. Other intermediaries can include foundations, faith-based organizations, charities, an employee or trade association. The last modality of outreach that we discuss here is the indirect outreach. Outreach can also take place less directly with information tools. Such tools can include traditional approaches such as physical distribution of printed matter and information. Mass media such as TV, radio, and newspaper may also be used to disseminate information. Online technologies are increasingly being used to promote outreach for social protection programs and delivery system, including websites, online self-service windows, mobile apps, and online notices via social media to raise awareness. And these technologies rely on certain degree of proactivity by the intended population to seek out the sites and apps, gather the info, and use the digital self-service windows. So outreach strategy can adopt either one of the above modalities or use a combination of two or more depending upon the program objectives and intended population characteristics and challenges faced by them. So now we talk about the strategies concerning different groups that we talked earlier in this segment. For example, for the group of children dependent on parents and guardians for access, the outreach strategy needs to include parents or guardian who would be the designated beneficiaries. Again, for elderly who have limited literacy or digital access, mobility, or challenges relating to aging, the strategy may rely more on direct communications or mass media, less on internet-based tools. Door-to-door outreach can also facilitate these group of people. Particularly for women who are disadvantaged and have mobility issues, outreach through direct communication, advocacy, counseling, or mass media, working with women self-help groups and organizations can also work out. So, all the groups that we earlier mentioned, there is a specific strategy that may be optimal, that may be workable based on their characteristics. And we would really appreciate if you can go through the strategies that are laid out for these groups in these slides, especially if you can see the strategies that are mentioned for the groups constrained by socioeconomic status, like the people living below the poverty line, people who are homeless, people living in isolated and remote areas, and then the nomadic or the indigenous group, refugees, ethnic, religious, and visible minorities. So it's food for thought and points to ponder after going through the rollout strategies, and you may reflect how the strategies mentioned here can be refined or how they can differ. So do think and ponder on these strategies that are given in the next 2 or 3 slides. Also focus on the strategies given for the laborers and workers, the informal workers, the unemployed, the inactive workers, and do try to come out with a refined version based on your experiences, that what is more workable or what could be a better approach, especially if we use the lens for Pakistan, or if we use the provincial angle, that what strategies are workable if we apply to different provinces or if we apply to the context of Pakistan. So based on the content and discussion, Two distinct operating models have emerged in diverse contexts to confront the challenge of inclusion, given differences in administrative capacity and funding constraint. We refer to these distinct models as on demand and administrator driven outreach. And the table you see here, it summarizes the model's key feature, uses, and requirements. So, if we can see the distinguishing features of both the model, in the on demand approach, people approach the state, whereas in the administrator driven approach, the state approaches the people. Also, the on demand approach, it focuses people who are specific individuals, families, or households, whereas in the second approach of administrator driven, the focus is on groups of clients, and that usually turns out to be households. Further, the type of population that are associated with the program for on demand approach, it is essentially individuals in demographic categories like children, elderly, then individual families or households based on socioeconomic status, then unemployed job seekers, part of informal labor, also the disabled category, and the at risk individuals. Whereas administrator driven approach, it includes families or households based on socioeconomic status, chronic poverty, or low income. And these are essentially poverty targeted programs. So, these are the main differences between the two kinds of outreach programs that we discussed.